Well, I recommend two ways. The first one is consider this a college research paper that you're writing with bibliographies and with footnotes. And don't make this a slacker project. This has to be a first-class project. That's the way that you're going to avoid any penalties and any problems with this. Now, the second way is work with somebody who's done this a few hundred times, has written this paper a number of times, knows how to get you through with the best process, the fewest mistakes. And also, you may find that you have some things you'd rather do with your time. If that's the case, then you need a professional. I'm your man. Let's get to it. I've been in the financial services industry for over 30 years. And when I was trained as a financial planner, the last thing that the trainer said to us is, hey, if anyone ever asks you about Medicare, send them to Social Security. Now, that worked great for decades. Finally, what happened is the phone started ringing. People started calling back and said, Gary, we followed your advice. We called Social Security, and they put us on hold. What are we supposed to do? I said, well, quite frankly, financial planners don't like Medicare. It's too complex. It's not worth our time and our trouble. But a preponderance of phone calls convinced me that for my clients, nobody was there but me. So I had to get licensed. I had to get certified. What I found out in working with my clients and their friends was people don't know what they don't know about Medicare. And quite frankly, they don't want to know what they don't know about Medicare. What they want is somebody who can lead them through the Medicare maze, get them the best options possible, and also to follow up on an annual basis, because insurance companies love nothing more than a client who falls asleep to which they can increase premiums and decrease values. My clients inspired me to start the business. Those phone calls I talked about kept coming. There was no alternative. You can go to an insurance company and ask them to help you out, but they will help you out of a lot more money than they will product. So for me, it was a matter of the clients I'd grown up with needed my help. I continued to help them. I segued into a business that nobody else seemed to be into. That's how I did it. Well, probably the most favorite thing is that I'm able to take an initial client with a high level of anxiety and concern about doing everything wrong, afraid of their shadow, and say, listen, I've been through this enough times. I know how to do this. I can walk you through this. You're going to get through this with no penalties. You're going to get the best options possible. And I've never received such a high degree of appreciation for a job I did in the financial services industry. The only way to do this is to, on an annual basis, review with the client those options they have and those options that are available. And what's going to happen is there are going to be new options that should supersede the value they already have. So it's my job to continue to be there to help the client upgrade their options, get a better healthcare plan, and save money. The idea is to keep as much money out of the pockets of the insurance companies as possible.